See what okay. Okay, unrecord.
Certainly feel free to interrupt or you can save them to the end. As Rob mentioned, I work for Hawaii Permanente Medical Group, which really in Hawaii means Kaiser. I'm just going to go through some of these slides. Okay. The agenda, we're going to talk a little bit about why was I interested in medical school, because obviously I had to get to medical school to this point, to get to this point. What's the schooling that's involved? A little bit about what I do every day, because I don't know that that's always familiar to everybody. Um, Kind of what I enjoy about my work. So why potentially healthcare, or in my case, why specifically general surgery? Um, when I was your age, let me start by saying when I was your age, I'm not sure entirely knew what I wanted to do. I had some sense of things that I liked and things that I felt were important, but I wasn't really sure where that road would lead. I'll say that with a caveat that you'll see. Okay. I knew that I wanted my career to be able to, be able to directly affect people. I think that for me, that provides some degree of meaning. Um, I've always enjoyed doing kind of hands-on things. When I was younger, I fix computers or make models or just do stuff, that was very hands-on. That was one of the things that really attracted me to general surgery, because as you can imagine, it's a pretty hands-on job. Um, Obviously, I've always enjoyed taking care of people. I think that's not to get real mushy about it, but kind of like a higher calling that I think all the folks in healthcare, really all the folks in not just healthcare, but lots of things that you help take care of your fellow man and woman. I think that's important. Um, Again, in a mushy sense, you get to do some good for the world. I think even when you have a hard day, well, at least did something good. That's a nice thing. And then in surgery, a lot of times, unlike other parts of medicine, a lot of what we do is we find problems, identify what the problem is, and then fix the problem. And then once the problem's fixed, it's not a problem anymore. And that's different from some folks that you might talk to that, when you go see your primary care doctor or something, and let's say they have to manage your blood pressure, which I'm sure they don't for you guys, but your parents, like managing blood pressure is a managing thing. It's not necessarily a fixed thing. It's hard to fix, and I knew as I went through medical school that wasn't something I necessarily enjoyed. Um, I would say that medicine and healthcare in general is a pretty stable career, as you can always imagine. Unfortunately, folks are always sick. Like there is always a need for folks in healthcare. Um, I think that specifically for medical school, there are opportunities to be your own boss and to kind of drive your own business if you want to be an entrepreneur. That's not really something that's really ever appealed to me, but I have friends that, have gone from medical school to really other jobs that don't necessarily have anything with directly taking care of patients. And so I think it's interesting for them. I have always believed that education will always open doors, and medical school is certainly part of that. And then I've enjoyed being a lifelong learner. It's nice to be in a job where things are constantly changing. I think about what I learned when I was younger in medical school, for example, and what we do now. And a lot of the stuff that we learned now we know is like, oh, that was totally wrong. You shouldn't do it that way, and so the job changes. And I think that helps keep it fresh. Um, a little bit of the timeline. I started med school in 1995. I actually graduated from high school in 1993. And so you may ask why that's 2 years later and not the usual four. And I graduated college 2 years into medical school. I actually went to a combined program. So I did 2 years of college followed by 4 years of med school and graduated college kind of in the middle. It's a little bit of a weird program, but despite me saying I wasn't really sure what I wanted to do, I kind of had a sense that it was in this direction, and this kind of set me off on that path a little bit early. I don't think it's for everybody. I think that actually one of the downsides was I didn't have much opportunity to explore, oh, what other things might I be interested in my life? The path for me was kind of set early on. And I think for those, for you guys in college, it's a good time to look at, what other things might I be potentially interested in. I graduated medical school in 1999. General surgery residency is a 4-year program. Means you finish medical school and you now are an MD. You could theoretically get you have a medical license, or you could get a medical license. You can't actually really practice medicine in most places because they require you to do more training, which is a residency. That's basically 3 to 5 to sometimes more years of training specifically in what you want to do. Whether you want to be a pediatrician and take care of kids, you want to be a general surgeon like me, a pathologist, a neurosurgeon. They're all different programs, different years. And I did most of this in the East Coast, actually. My first introduction to Hawaii was when I was here in 2004, 2005, doing surgical critical care at Queens. That's basically taking care of people in the ICU, in the intensive care unit, so some of the sickest of the sick. After that, I worked for Kaiser in Northern California, mostly because my parents live in California. I grew up in California, and I thought I should move closer to them. And I was there for a year, and I said, you know what, I miss Hawaii, and I moved back. And I worked at Queens for 5 years, mostly doing trauma, and then I've been on Maui working for Kaiser since 2011, and I figure I will be here, I think, to stay through the rest of my career. So. What do I do every day? And this is not a picture of every day, but this is a picture of fairly frequent. In clinic, you guys have gone to the clinic for something, I'm sure. You go and check in and you see your doctor for like 2 seconds, and they poke on your belly and say, you're great, have fun in school. That's clinic. You've all been in the doctor's office before. And what I do in clinic is I see new patients. I follow up on patients, and I see patients after they've had an operation. So this gentleman on the left, you can see this big bulge he has on his pico. That's a big hernia. I'll tell you a little bit more about hernias later, maybe. And that's what people come into the office with. I have this problem. What can you do about it? And some of the common things we see are hernias like this, where there's a hole in one of the deeper layers in the wall of your belly, and stuff's pushing out through that hole and making a bulge. When you guys are at the beach, if you guys see anybody with an outie belly button, most likely it's a hernia. So you'll see those all the time. Okay. We see folks with gallbladder problems with their intestines, a lot of skin cancers, sometimes benign and also cancerous tissue, soft tissue masses, breast cancer, colon cancer, and then also anal rectal issues. Those are some of our most common things that we do, okay, that I do. Obviously, another part of my job is being in the operating room, and I don't know how many of you guys have had operations before, but it's probably some, okay, or people that have had. And this is a fairly modern operating room. I'm not sure what they're doing, but you can see something on the camera up here. And in an operating room, there's an anesthesiologist doing the anesthesia, obviously. Generally one surgeon, potentially an assistant that could be another surgeon, or maybe a PA, or maybe a nurse, and then a scrub tech, and then a circulating nurse that you wouldn't see in a picture like this. And that's kind of the minimum number of staffing in an operating room. Sometimes there's radiology techs, gosh, I don't even know who else, device representatives, other people involved. Operating room is a great place to be. It's a very unique environment. I think for, many people, they talk about, like runners talk about a runner's high. People talk about kind of being in the zone. I think for many surgeons, the operating room is our opportunity to be in the zone and to be very both physically and mentally focused on whatever the task is right in front of us, and not have to think about whatever else is happening in our lives or, in our jobs. In some ways, it's actually kind of a little bit of a mental escape, even though it's, it's a pretty high intense place to be also. This is a little bit of an example of some things you can see in an operating room. The photo on the left, this is your liver, your stomach, your pancreas, your gallbladder, and your bile duct. You guys may know that your gallbladder drains bile through this bile duct into your intestines. And if you look on the right, this is a bunch of pictures, not from me, I just stole from the internet, of someone's gallbladder. And that's what this is here, your gallbladder. your liver up here, another gallbladder with some of the normal fat that we have inside our body kind of stuck to it, another gallbladder. And so this is laparoscopic surgery, meaning small cameras and small incisions. And taking out gallbladders is a real common thing that we do. I bet some of you guys have parents that have gallbladders that have been removed. Other thing that I do is I work in the hospital. So this is Maui Memorial, both in terms of if there are patients that are in the hospital that need a general surgeon to see them. Those are patients that we will walk through and see. How are you doing? Are you ready to eat? Are you ready? Do you need your medications changed? Can you leave the hospital? That kind of stuff. We also are on call for the emergency room. So if you come in through the emergency room with some issue that needs a general surgeon, then potentially I will get called. And many times those folks will need to have an emergency operation. The common things that we see: appendicitis, cholecystitis, which is a problem with your gallbladder, various kinds of infections. Sometimes cancers can lead to acute problems. Obstructions or blockages, oftentimes of the intestines, perforations or holes in things like holes in your intestine. I wrote this twice, but bowel obstructions again. And an example of somebody, you guys, I think, know Stephen Colbert. You're old enough to know him. He recently had a ruptured appendix, and his show ended up canceled for a little while. On the bottom, you can see not his CAT scan, of course, but some CAT scan I found online. Your appendix, like you guys may or may not know, hangs off your large intestine down on the right lower side of your belly. And there's a variety of theories as to what the appendix does. No one's entirely sure, but I know that it wakes me up in the middle of the night a lot because sometimes it ends up getting infected. And this arrow points toward the appendix. This is your large intestine here, and it's a little hard to see, but you can see how the fat around here is a little hazier than it might be out here under the skin or even here closer and deeper in the belly. Anytime you see this haziness, that's a sign of inflammation. And here, again, the arrows really help, but that's part of your appendix. This is someone else's appendix, and it's certainly larger than it's supposed to be. And these white things you see are what we call fecaliths. That's basically kind of solidified poo, more or less. And it makes little stones that will sometimes collect in your appendix and can sometimes block your appendix. When you have appendicitis, you have pain in your belly, sometimes by your pico, sometimes down on the right lower side. If it goes for long enough, then eventually your appendix makes a hole and it's now ruptured. This is a normal looking appendix. Here you can see an instrument that someone has. This is part of their small intestine. The appendix is right up here, and the blood vessels that go to the appendix are here. They've lifted it up now, and again, lift it up more, and you can see where the appendix plugs into the large intestine right here. And then they cut it and stapled it, which is what we're looking at here. The appendix is probably out of the body at this point. This is an image of what perforated appendicitis can look like. You can just see all this pus, which is the body's reaction to having an infection there, right? And you can see all the tissue looks real inflamed compared to the photo from before. Obviously, if you have perforated appendicitis, it's a more complicated thing, harder operation, a little bit of a harder recovery. And as I mentioned with lifelong learning, laparoscopic surgery is something that was getting to be common when I started training. It was certainly something that we did regularly for gallbladders, for appendicitis, and oftentimes for hernias. Over the past, I'd say 5, maybe 10 years, robotic surgery has become more common. We don't have a robot on Maui yet, but I suspect we will eventually get one. So I don't do this, but I have partners that do. And with a robot, you have a robot that actually physically holds all the instruments behind this nurse that are sticking in the patient. And the surgeon sits at a console and essentially does video games as to, moving the robot arms around. The benefit of it is you can see better. A robot has a wrist on the instrument, which a laparoscopic instrument does not have that degree of movement. And also whatever inherent tremor we all have, a robot can get rid of. It's a pretty handy thing. That's one way that the technology drives improvement in care. It's pretty cool to see this happening. I suspect in my career, you will probably see an AI like computer-driven robotic surgery with a human as the backup. Probably something simple like a straightforward appendicitis, but I bet that that will eventually happen. I don't think that'll put me out of a job, but it'll be interesting. What do I enjoy about my work? Like I said, I'm never bored. You never know what's going to roll through the door. It's always something, it can be very, something very unusual that requires you to do a lot of thinking about. Like I mentioned before, I feel like I'm doing something. It's nice to see the post-op patients doing well. Maui is a small place. I see my patients all the time. I go to Costco and, there's someone that I took their appendix out, and that's very gratifying to me. I work with great people in healthcare. It is a team. It is a team sport in a big way. The surgeons oftentimes think we're the captains of the ship, and that's probably true, but there are a lot of people on that ship helping you to get to where you need to be. And I think folks in healthcare all have some degree of an altruistic motivation, which is nice. You get to fix things. As I mentioned, I like to do that. And you're always trying to improve, whether my own performance or even the performance of how my team is doing, or the performance of how my clinic is doing, or the performance of how Kaiser is doing, like there's always something to fix. And as I mentioned, you get to take care of people. That is all the talk that I have. Thanks all for listening. If you guys come to the, I think Saturday, correct, session?
Yeah.
I'm going to bring some surgical instruments for you guys to be able to see. Unfortunately, we cannot operate on anybody. That would be painful and illegal. But at least you can see what the instruments are like, and I can tell you a little bit about kind of life in the operating room. Any questions? Rob, take it away.
Yeah, we can open up the Q&A session now. Does anyone have any questions for Dr. Tan? Maybe? One that I thought of actually. Dr. Tan, so you studied majority like on the East Coast as well as West Coast, and now in Hawaii. Do you think there's like a difference in the maybe not the standards of medical practice, but like the environment
Oh
of,
yeah, absolutely. The culture of medicine is very different. The East Coast, I think, was very intense. It was very high pressure. It was very fast paced. Like things had to get done immediately, sometimes for good reasons and sometimes just because that's how it was, and it was very high pressure. I think we had a good number of folks that were in my residency that ended up not finishing, and they either changed or they did something else. It wasn't for them. The West Coast is a little bit less intense, and I think Hawaii is a little bit less intense, to the point that we have folks that have trained on the East Coast, and when they come here, like you got to tell them, dude, you got to slow down. Like you can't yell, which was common in the East Coast. Like it just doesn't work. You try to push people like that here, and things will happen slower. So that is an interesting thing to see. I certainly appreciate being here much more. I think it's much healthier, but interesting. There's a question: what is the most important piece of advice you heard? You heard in medical school or in the workplace? That's a great question. One thing that I have always seen to be important is, especially when you're new, especially when you're learning, I think the people that do well or the people that make an impression are the folks that will say, I want to have more responsibility. Like I want to do more. Sometimes we get real passive students. I used to work with, when I was on Oahu, I worked with the med school there a lot. I still work to some degree with some of the residents, both at Tripler and at Queens. But sometimes you get real passive students that, they're there, but they're not real interested. They're not real involved. Or you get other people that, say, hey, okay, show me how to do this. Okay, I know how to do it. I'll do the next one, and I think that interest, everyone has, all your teachers, like they all have a limited amount of time. Like they're going to expend the most effort in the folks that are interested. It's not necessarily always fair, but it's kind of a fact of life, you know, and I think that's an important thing.
Wonderful. Is there any other questions for Dr. Tan that we might have? Probably have time for at least one more until we close out. Um, Nothing really.
All right.
Maybe just one more quick question. Dr.
Sure.
Tan, maybe could you try like and describe like your profession in maybe one word?
Humbling.
Humbling.
So I really do think it is. It's medicine and surgery is a very humbling job. You think you are doing great, and you know, part of our job is not everything you do works out great. You know, sometimes folks are real sick and you can't help them, or sometimes despite your best efforts, just didn't work out. I think in that sense, it is a very humbling job. And I think that's okay. You know, you want people that are confident. You don't want people that are overconfident. So,
Exactly. Okay. Thank you very much, Miss or Dr. Tan.
yeah.
Uh, right now, I think it is going to become 6 o'clock, but if there are any other questions from any of the students, you guys are free to leave. We'll be closing out the breakout room session. Thank you very much for coming here.
Okay.
Especially thank you to Dr. Tan.
Have a nice day, guys.
Mhm. Bye. Thank you.
My computer died.
Okay, I'll close out this main session, so, or not this main session, this breakout room, so feel free to check in with the main session, and if Mr. needs anything, then yeah, but if not, I think we're almost off free to go.
Okay, 10 to 12.
Yes.